Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today, I shall try to impart the knowledge on ginger. Titled Ginger Anti-Inflammatory Effect on Metabolic Syndrome. Yes, you may be wondering why I have chosen just one spice or herb, ginger. It is all because of a recent experience. Somebody advised on it that one person should use it for uh, as health medication. So I tried to do a study and I come to understand that ginger is very, very useful. And that's why I've decided to expose the benefits of ginger. That is, whether you chew it or you grind it into liquid and you drink the liquid once a day or thereabout, there is something positive that you get out of it, especially for those people who are prone to being fat, experiencing hypertension and other aspects of these common chronic diseases associated with old age. So my effort today, therefore, is to expose the knowledge on ginger and also the laboratory aspects that proves more or less that yes, it is an effective herb or spice for metabolic syndrome, associated metabolic syndrome problems. So if you like my presentation, please, as usual, click the like button, subscribe, and more effort will be put into find out more things, knowledgeable things. And let's move on into the slides section. The objective: to create the necessary awareness of the health benefits associated with ginger spice vis-a-vis its observable effect on inflammatory markers in the medical laboratory, which is suggestive of its medicinal role in alleviating some metabolic syndrome health issues. Introduction. According to Habib SH and his co-workers, ginger rhizome is a very popular spice with negligible side effects all over the world. Phenolic compounds in ginger include gingerol, paradol, and sugarol. These compounds reduce the risk of atherosclerosis, inflammation, angiogenesis, and oxidative stress. More workers did that. More than 40 antioxidants have been extracted from ginger rhizome. Another worker, Black et al., did a serious work on that. Cardiovascular diseases usually present with increased systemic inflammatory indicators such as interleukin 6, tumor necrosis factor, and C-reactive protein, a risk factor. These are what I shall make effort to prove, to expose in this little study. There are more findings from more studies. A Japanese study showed that active constituent in ginger reduced the blood pressure and decreased cardiac workload. It reduced the formation of pro-inflammatory prostaglandin and thrombosin, thus lowering the clotting ability of the blood. And once that is made possible, it's like a thinning effect. It thins when you talk of blood thinners. That's part of the things that the ginger could do. Ginger can prevent the increase in cholesterol level following intake of cholesterol-rich diet. It also known to possess antioxidant property. The effect of ginger spice on inflammatory marker is the main target of this work. Now, laboratory investigations. Inflammation has now been incriminated as a causer of metabolic syndrome. That is, those who are obese and have high blood pressure with it is now becoming more obvious that the inflammatory reactions really more or less increase this tendency to be more obese, increase in high blood pressure, and stuff like that. And that is why anti-inflammatory substances have been used to avert the cardiovascular complications associated with metabolic syndrome. The main components of metabolic syndrome include obesity, high blood pressure, high blood triglyceride, low level of HDL, cholesterol, and insulin resistance. In order to show the anti-inflammatory properties of ginger, I shall first expose its effect on inflammatory markers in the laboratory. Yes, inflammatory markers. These are what we examine in the laboratory. We look for their values, whether they are increased or normal. When they are increased, it shows clearly that there is that inflammation in that person. But it is not a specific test. One of them is erythrocyte sedimentation rate, which shows the red blood cell sedimenting at a faster rate. Then there is the C-reactive protein. It serves as early acute marker, the kind of protein that is produced when there is that inflammation in the body. There is the plasma viscosity too. It is now increased more or less. The interleukin 6 too and procalcitonin. Now to findings that was discovered with issue of metabolic syndrome. This is a research, or many researches rather, because it's a mental analysis on ginger being used in a study to see its effect on those factors listed for metabolic syndrome. So a random effect model meta-analysis was used for quantitative data synthesis. Sensitive analysis was conducted using the leave one out method. The result shows from a total of 265 entries, we are now talking of entries, not that persons. We are talking of different research identified via searches. 9 studies were included in the final selection. The meta-analysis indicated a significant reduction in serum C-reactive protein, part of the concentration, following ginger supplementation. Weight means difference. And that's the other one is also its effect on fasting blood glucose and also the HbA1c. And respectively, moreover, they also discovered that the high density lipoprotein that is also necessary to be high, which if it's reduced in MES, that's a factor in MES syndrome. And triglycerides significantly improved after ginger administration. So these findings were robust in sensitivity analysis, and that should help convince one that yes, ginger needs to be further studied, agreed, but it is showing this positive sign of alleviating those factors that forms that metabolic syndrome, that constitute the metabolic syndrome that usually result in serious cardiac problems, stroke and heart attacks. The conclusion from that study, this meta-analysis suggests that ginger supplementation significantly reduced serum CRP and improved glycemic indices and lipid profile. Randomized control trials with larger sample size and with a longer term follow-up period should be considered for future investigations. Yes, another study on the effect of ginger on inflammatory markers shows this highlight. Their finding was high sensitivity C-reactive protein. This now focus on is considered to be involved in the pathogenesis of insulin resistance, diabetes mellitus, and metabolic syndrome. Hence, suppression of the inflammatory response is an important point in the management of chronic diseases. That's a study by S. Jollard and his co-workers. The conclusion from that study involving so many workers, our meta-analysis indicated a significant lowering effect of ginger supplementation on circulating CRP, high sensitivity CRP, and tumor necrotic factor concentration. However, these outcomes should be declared with caution due to the limited number of studies and the evidence of heterogeneity. Finally, the conclusion. Yeah, I did not include some other papers that are also positive for the anti-inflammatory effect of ginger and effect on the metabolic syndrome, especially the blood pressure, where it helps even lower the blood pressure. But these are all studies that have not been conclusively concluded. So it should be noted that inflammatory markers are not specific for inflammation, because other disorders like infection, anemia, etc. could present with high values of inflammatory markers. That should be noted. So it may not necessarily be that the the lowering effect of ginger is because it's on the inflammation, but it could be on the infection because it's also associated as antimicrobial. It has antimicrobial effect. So these are all things that has to be really fully studied. However, the finding shows a serious association with metabolic syndrome, and because of the low side effect of ginger, it is advisable that one could use it to lower some detrimental inflammatory markers. And I believe the rate at which people are already using it shows that it is positively affecting their health. And so my own way, if I have to make a decision, I will recommend that people who tend to eat oily and fatty food and have high appetite, taking high calorie food should especially use it in order to combat the inflammation that is associated with metabolic syndrome. Like I said, always check my video. It's full of so many health issues, health concern issues, knowledge on on health, and health is wealth. So look more. There are more than 100 videos on health matters.